We have an obligation to those that passed and to those that suffer with long-term health issues from long COVID to hold the institutions accountable. And that is our hospitals, the for-profit healthcare system. And it's my hope that this is a step in that direction, because right now, if you've probably noticed, the entities that are holding healthcare responsible are labor unions. It's nurses. It's the the 7-state strike SEIU had with 85,000 health workers putting something at risk so the world might be better.
You know, when we're talking about what's wrong with our health system in the United States, there's a lot we could talk about. Big pharma, big insurance companies, and we have to talk about hospitals and hospital systems. Hospital consolidation is really changing the landscape of healthcare for so many of us. We've had more than 25 years now of hospital consolidation that has left way too many communities across New York and across the nation without timely access to needed medical care. As you can see from this slide, increasing numbers of independent hospitals have been joining health systems. About 2/3 of all hospitals in the U.S. are now part of a system. Why do hospitals join a system? They fear standing alone. They're overwhelmed by the complexities of negotiating what these value-based contracts require. They also have aging facilities, and they need access to capital to upgrade those facilities. Why do systems want to acquire hospitals? They want to acquire market share so that they have bigger negotiating power with health insurance companies. You've seen the health insurance companies merging over the years. The hospitals are merging. It's a tug of war where they're both trying to come out on top. There's other reasons, too. They want to acquire the physicians and physician practices that are associated with the hospital because those physicians send patients to hospitals. So if you acquire a hospital and all of their physician practices they own, you're going to get their patients, too. And finally, we're seeing, unfortunately, in the case of private equity acquisitions, we're seeing private equity firms buying up hospitals, loading them up with debt, and then sometimes forcing the hospital to pay them to lease the facility that they once owned. These are the top 10 health systems in the U.S. It's a list I took from Becker's Hospital Care. And I want to point out a couple things about it. Those that are in red are for-profit. The blue ones are religiously sponsored health systems, most of them Catholic, some of them Seventh-day Adventist, Lutheran, Baptist. When they take over your hospital, they ban all the things that conflict with their religious doctrine. But what we do have is nonprofit hospitals behaving like for-profit hospitals. We now have, I should say, more than 40 hospitals have closed over the last 25 years across the state, including St. Vincent's downtown, which was just a mainstay of the community. But we now have big hospital systems controlling more than half of the hospitals in the state, 70% of the acute care beds. We have got to strengthen government oversight of hospital consolidation.